Hi there. This is a presentation on our final year podiatry project on increasing cultural sensitivity and awareness amongst podiatry students. My name is So, and my partner is Alex. Australia is a country that prides itself on multiculturalism. Good practice involves genuine efforts to understand the cultural needs and context of different patients or clients to obtain good health outcomes. Many podiatry students lack experience and confidence when treating people from culturally diverse backgrounds. There are limited resources at La Trobe that provide information about cultural beliefs and traditions that may alter a consult or treatment plan. These were our aims and objectives. First and foremost, we wanted to gain data on confidence and awareness levels of students when treating people of diverse backgrounds. Secondly, we wanted to provide a resource to educate both students and supervisors on cultural awareness and sensitivity. And lastly, we wanted to provide a multilingual handout for foot health in the elderly or diabetic patients. Our project process involved these 4 stages. In the planning phase, we established that we would like to get an understanding of baseline confidence levels of podiatry students when treating people of different backgrounds. In our doing phase, we created a survey to get a quantitative measure of their confidence and to discover any common problems they've experienced. Study phase involved reflection on the student feedback and gather more information from online sources. And in our final stage, we created the resources and aimed to make it available to students and at the La Trobe Clinic as well. One of the deliverables for our project is the survey, which included questions about communication, exposure, confidence levels, and medical interpreters. Literature review of resources discussing cultural awareness as a healthcare professional. Then information was collated and analyzed and used as a guide to develop our resource. So, what did our survey find? Students said that their exposure levels and information received on placement was 5.16 out of 10. Their confidence in treating people from diverse backgrounds was 6.75. 90% of students said that they've worked with an interpreter or a family member. However, when asked about how confident they felt about working with them, the result was an average of 5.7. Students were also asked for an example of a time a treatment plan or consult had to be changed because of a person's cultural beliefs and traditions. Some of the common responses included a preferential treatment of the same gender, depending on background, the use of traditional or herbal medicines, differing body language meaning, and cultural beliefs that impede certain treatments. Example, daily foot washing. These examples, plus the use of our survey results and a literature review, provided the information that we would use to develop the draft for our informative brochure. The evaluation process. This involved distributing our initial draft to the students and getting feedback. Some of the feedback that we got back was that there was too much information crammed into the brochure, especially in the interpreted section. However, not as much information on non-verbal communication. Constructing our resources. We had to create 2 resources, one of which was the informative brochure, and that involved gathering information with a survey, getting anecdotal information and online materials, getting student feedback, and then presenting that information in a clear, direct manner in a brochure. The other resource we wanted to create was the multilingual handout, using online information and discussing with private podiatrists to put together a simple message about general foot health. We researched most commonly spoken languages in Melbourne, and we found people to translate into the 5 common languages, which were Italian, Greek, Chinese, Vietnamese, and Arabic. These are some of our limitations. In terms of the survey, we didn't have experience using SurveyMonkey, and due to time constraints, we used private messaging through social media. We realized that the student confidence levels may be due to already lacking confidence and not necessarily competence. Some students didn't reply to our survey, and we couldn't distribute the survey to as many students as we would have liked, as we didn't have them connected on social media. and survey results may not reflect the entire fourth-year cohort or podiatry students in general. Limitations to our rollout. Due to time constraints and availability meant that the resource wasn't given to as many students as we would have liked. The lack of proper interpreters meant certain languages weren't translated correctly for the multilingual handout. Resource limitations. Some information for the resource was difficult to obtain as it was mostly anecdotal and certain areas lacked research to include in the brochure. Team consisted of only 2 team members and at times lacked manpower. Face-to-face meetings were difficult to organize due to availability as well. Project recommendations. To promote awareness of the resource and importance of cultural awareness in the podiatry clinic, encourage supervisors and other students to share resources and experiences and to develop further resources. To conclude, this project highlighted the importance of developing brochures and sharing information when it comes to cultural awareness. Although it can be difficult to pinpoint exactly what is to be said on these resources, the more information that is shared, the better prepared students will be when entering the workforce. The following are our references, and please also refer to our final report to view our pamphlet. Thank you for listening.